Good day. An incident report alone does not improve safety. And in many years working across aged care governance and clinical management in Australia, one of the most persistent failures I have seen is organizations responding to incidents without ever understanding why they happen in the first place. That is where root cause analysis becomes essential. A root cause analysis, or we call it RCA, is a structured, systematic investigation process used following significant clinical incidents. This includes serious falls, medication errors, clinical deterioration, pressure injuries, unexpected death, or in the event that meets the threshold for a serious incident response scheme notification under the Aged Care Act of 1997, as strengthened by the Serious Incident Response Scheme that came into effect in April 2021. The purpose of the RCA is not to identify who made the mistake. The purpose is to understand what condition within the system allowed the incident to occur, which safeguards has failed, and what needs to change so that it does not happen again. Let me work you through the process. The first step is to 1. Identify the incident precisely, establish factual chronological timeline of events, avoid assumption at any stage, what really happens, the sequence, using objective language. The second step is to gather all relevant evidence. In my practice, this means reviewing progress notes, medication administration records, handover documentation, staffing levels at the time of the incident, escalation pathway, and any existing risk assessment related to the person involved. The third step is identifying contributing factors. This is where I encourage you to ask the harder question. Was there a failure in clinical handover? Were early warning signs documented but not escalated? Was the care plan current and reflected to the resident or participants' actual needs? Were staffing levels adequate at the time? Were relevant policies accessible, current, and understood by the team? The fourth step is identifying the root cause. And in my experience as a care manager, the root cause is almost always a system weakness, not simply individual error. The most common findings I have seen included inadequate supervision structures, gaps in staff education, poor communication system, outdated policies, and failure to act on prior incident trends. The first step is implementing corrective action that are specific, measurable, assigned to a responsible person, and reviewed within the defined time frame. In governance, an action that cannot be measured cannot be verified, and that action is not reviewed is just as good as intention on the paper. In Australia, effective root cause analysis align with the National Safety and Quality Healthcare Services Standard, specifically Standard 1 on clinical governance, the aged care quality standards, particularly Standard 8 on organizational governance, and the obligations under the SIRS scheme. The Australian Commission on Safety and Quality in Healthcare is clear that organization must move beyond reactive incident management and build a system focused on the prevention and continuous improvement. A well-conducted RCA is also a document that demonstrates accountability to regulators, including the Aged Care Quality and Safety Commission, in the event of a regulatory audit or a coronial inquiry. The quality of your RCA process directly reflects the maturity of your governance system. Here is the principle I come back to every time. If the same incident keeps happening in your facility, the RCA has not been addressed. Investigation without action is documentation without integrity. Real clinical governance is not about finding who failed, it is about understanding why the system failed and having the courage and structure to fix it. Hi, I'm Ed from Clinical Insights with Ed. If this is useful, share it with your team, subscribe, and and see you next video. Bye.